CLI is also known as critical limb ischemia, and it represents the end stages of another serious condition called peripheral arterial disease. Now, why CLI is so important to understand is that there are serious comorbidities that are attached to it, namely amputation and death. The standard treatment for critical limb ischemia, unfortunately, is so variable that I've coined the term the amputation lottery, where it's involved. In other words, if somebody happens to land in the hands of a practitioner who is dedicated towards limb preservation, they have a much better chance of a good outcome. However, there's really still no standard treatment in terms of critical limb ischemia. Unfortunately, more than half the amputations that are done in our country are still done without a prior vascular test, even something non-invasive. So what this really means that a lot of times amputation where critical limb ischemia is involved is really subjective, and unfortunately this is often the standard of care and is the first line treatment. Amputation is necessary basically on a case-by-case basis. In other words, we're often, again, too quick to amputate, in my opinion. There are so many patients out there that can be saved by intervention. However, amputation still is often viewed as the solution when things are going bad or where critical limb ischemia is involved. With the limb flow procedure, it has the potential to really be a game changer in our world. Right now, we've got the emergence of endovascular procedures that generally includes use of balloon angioplasty or stents or lasers, or in some cases even shaving plaque from vessels. However, when we've got some of these patients who are really no longer offered further options where endovascular procedures go, bypass of the lower extremity has often been viewed as the gold standard, especially among vascular surgeons. This is part of the debate that's gone on over the past several years. But to offer a technology such as limb flow, where essentially you can perform a lower extremity bypass without the trauma that is involved in the traditional surgery, could really make a huge difference for many people, especially again where we have vessels that are so severely calcified that no other options are offered in terms of endovascular procedures. My expectation for limb flow is really, there really are several aspects to this, and why I believe that the company is onto something special. It gives us another important tool to offer our patients in terms of a second chance. What we're all about in my world is not only reducing lower extremity amputations, but really giving people quality of life back. Offer them a second chance, maybe where there was none previously, or maybe they've been told that amputation is the only option. And even in cases where patients may have lost one leg, to be able to preserve that other leg may mean the difference between not only a premature death, but also having to leave their home and go on into an institutional setting because their support system is no longer able to care for them. So just having one leg can mean all the difference in the world for somebody.